Good afternoon, everyone. I'm Cameron Friesen, Minister of Health, Seniors and Active Living for the province of Manitoba, and I am again joined by Dr. Brent Roussin, Manitoba's Chief Provincial Public Health Officer, here to do our Monday briefing. I just want to preamble and say to Manitobans that many things are underway at this time, but that we made a commitment to also expand screening sites, and there's a lot of work that is going into the ability to make sure that we have the proper screening site capacity in place. And so later this week we'll be opening the first of these additional screening sites that will come online. DynaCare is providing additional capacity for screening sites, and that will be a benefit to all Manitobans. So with that, I'll give things over to Dr. Brent Roussin.
Thank you, Minister. Good afternoon. Current 5-day COVID-19 test positivity rate is 2.2%. 39 new cases of the virus have been identified today as of 9:30 a.m., bringing the total number of cases in Manitoba to 1,919. Today we're also reporting an additional death related to COVID-19, male in his 70s from the Prairie Mountain Health region, bringing our total number of deaths to 20, and we send our condolences to their family and loved ones. Today there are 7 cases in Interlake Eastern, 7 cases in Northern Health region, 3 cases in Southern Health, and 22 cases in Winnipeg Health region. We have 618 active cases with 1,281 individuals that are recovered. We have 13 people in hospital and 7 in intensive care. And the number of deaths due to COVID-19 is now at 20. Lab testing shows 2,647 tests were completed on Friday, 2,196 on Saturday, and 1,596 completed on Sunday, bringing our total to 180,750. Manitoba or Winnipeg metropolitan region is now in a restricted level according to the pandemic response system. Mask use is required in all indoor public places, including bars and restaurants. Staff and patrons are expected to wear masks except while seated at a table while eating and drinking. We're restricting gathering sizes, both public and private, to indoor and outdoor to a maximum of 10 people. For the private gatherings, this number does not include the people who live at that household. So an example is a family of 6 could still have in a household could still have 10 people over as guests. We do strongly encourage people to reduce their contacts from outside their household. All the other existing orders for schools, childcare, retail, museums, theaters, sports, casinos, etc. remain the same for the time being. In addition to these measures, Public Health and Manitoba have continued consultation with the restaurant industry, as well as bars, beverage rooms, brew pubs, microbreweries, distilleries, on steps to that can be implemented to lower the COVID-19 transmission risk. Additional measures may be put in place following these consultations. We've seen the effectiveness of these kind of targeted response in the past, and Prairie Mountain Health is our example of that. As we raised the pandemic response system level there, we saw a relatively quick turnaround of the numbers. We know Winnipeggers have done this before, and we've worked together to bring down those numbers, and we can do that again. So under the pandemic response system, we have these tools to take targeted action to prevent widespread social and economic isolation and closure. We're relying on all our partners in Manitoba and in the region to do their part to lower the risk of transmission in Winnipeg. We have some exposures. Over the weekend, we notified the public about a number of possible exposures to COVID-19 at schools, personal care homes, and other public spaces. Today, we're advising possible exposures at St. Maurice School in Winnipeg on September 17th and 18th. Second confirmed case of COVID-19 at the school on these dates where the individual may have been infectious. Based on the investigation, this case not linked to the first case. The infection was not acquired at school, and the exposure was assessed to be low risk. Other possible exposures include Denny's, 4100 Portage Avenue, Winnipeg, September 18th from 11 a.m. to 3 p.m., and September 20th, 7 a.m. to 1:30 p.m. And XXI Lounge, 1011 Portage Avenue in Winnipeg, September 18 from 10 p.m. to 2 a.m. and September 19 from 10 p.m. to 2 a.m. Again, encouraging people to reduce the number of contacts they have outside of their household. We need to continue to practice those fundamentals, staying home when we're ill, even if mildly ill, washing our hands frequently, trying to practice that physical distancing when all possible, and wearing a mask when indoor public places. And certainly in Winnipeg and the surrounding regions, it is now mandatory to wear that mask indoor public places. When wearing a mask, it's important to use it properly, ensuring it's covering the nose, mouth, and chin without any gaping, to wash your hands frequently if you are required to touch the mask. And we know that all of these actions not only protect ourselves, they protect the people around us, people we love, and our community. So encourage Manitobans to step up once again to reduce the transmission of this virus, and visit our website, manitoba.ca/COVID-19 for up-to-date information, and can open up for some questions.
Dr. Roussin, what's the Heritage Lodge outbreak up to now in terms of patients?
Heritage Lodge has 5 confirmed cases, all in residence.
And what is Parkview Place up to now?
Parkview Place has 14 confirmed cases, 2 staff member and 12 residents. And Bethesda Place has 18 confirmed cases, 10 staff members and 8 residents. And 4 of those residents had passed away.
And there was one more, forgive me, John Pritchard School cluster.
Yeah, John Pritchard is at 33 total cases, 6 of which are just epi-linked to the cluster.
I'm sorry, once more?
33 cases in total, 6 of which are epi-linked.
Dr. Roussin, there's a lot of frustration from people who have maybe had to cancel weddings or other events because of the 10-person limit, and they're frustrated because they've had to do that, but bars are still open and restaurants are still open. What's your response to their frustrations, and can you explain why that is?
Well, we know that group sizes, period, will form an important risk factor, and they always have for this. So that's why our very first targeted intervention was at group sizes, and so our interventions will almost always include group sizes because we know that's the biggest risk. We already have restrictions on bars and restaurants, and we're working now to try to improve that. So it's very likely we're going to see more interventions on it. And I think it's been challenging right from the beginning, but these measures are here to reduce the impact at the provincial level. So certainly at individual levels, it will have hardships, and a lot of Manitobans have faced hardships, and we're doing it together to try to reduce the impact. We know there's a lot of 20s, 20 to 29-year-olds getting these coming down with COVID. We know it relates a lot, or at least connected in some ways, to bars, to restaurants. But we also know that these individuals also attend weddings and funerals and other groups. So it's we have to put steps in place to try to reduce the risk.
Can you give us an idea of what kind of restrictions would be in place for bars and restaurants, whether it's spacing out or how many people can be in there? Can you give us an idea of what we might see?
So I won't frame it here as restrictions necessarily. I'll frame it as the things that we've seen as issues that we're going to try to work out. And so we do see with some capacity, especially later in the evening, ensuring that all the capacity and distancing measures are in place throughout the time the place is open. We now have masks mandatory in those places. There's reports here in other jurisdictions that loud decibel levels, loud music means people speak louder, speak closer together. So it's another thing we could look at to maybe try to reduce that type of risk. And so those are the type of things we're going to be working with the sectors on, trying to see how we can best limit those risk factors.
That's why some jurisdictions, they've reduced the hours. It's not that the virus gets more contagious after 11 or midnight, it's that it becomes a little more challenging to control movement and people and that sort of thing. Is that what you're looking at too, in terms of hours?
Well, we're looking, we're looking at, we know that that's what we see, is that from reports, is that the later hours are less adhered to, the public health order. So that's what we're going to reach out to the sectors, what kind of ideas we have to ensure that public health guidance is adhered to right through the time.
We're just over 2 incubation periods away from Halloween, and I know you've faced the Halloween question before. At this point, can you give parents and kids any indication as to what might be done with Halloween, whether there might be public health orders affecting the sort of door-to-door capacity?
So we're going to provide specific guidance on that in the upcoming weeks. It's certainly going to look different than what it normally does. We have to limit the amount of contacts. It always comes back to the fundamentals, right? So we need to limit the amount of contacts. If people are planning gatherings, of course, they're going to have to adhere to the public health orders. If we're going to have any sense of Halloween, we're going to have to do it in a way that limits many contacts, through people. So we're going to work and provide some specific guidance to people to allow them to make informed decisions.
Because trick-or-treating involves some contact. It's short-term, obviously, but there's some surface touching and that sort of thing, and short-term, but very close contact.
Right.
Is trick-or-treating a go this year?
Well, like I said, we're going to provide the guidance on that. We haven't made a specific decision on that. But like I said, we need to prepare that it's not going to look the same as other years. We can't, there's numerous points of contact with trick-or-treating. And you said it is brief interventions, or interactions, but it's still, when you add it all together, it can have a significant impact.
Saskatchewan actually just put out specific guidance for Halloween, Thanksgiving, which you've basically advised people against large gatherings, and fall suppers. So have you seen those guidelines?
No.
What do you think of-
No, like at our special advisory committee at the Council of Chief Medical Officer of Health, we provided, or working on a document on guidance for Halloween. And so that's nearing its end stages, and that's what we'll likely be drawing on for our guidance.
Go ahead.
Dr. Roussin, what can you tell us about the 7 new cases in the north?
Mm-hmm. Yeah, so this is the 7 new cases in the north related to close contacts. I won't provide too much detail. What I can say is that there's been some questions about a delay in reporting on that, and it certainly wasn't a delay in public health action. So these were diagnosed with the rapid test. And so immediately upon the result, cases are identified, contact tracing, people are being self-isolated. But our standard process is to not report those out until they're confirmed through the typical test at CADM Provincial Lab, which is why we're reporting it out officially today. But there was no delay at all in actual public health involvement.
Can you say anything about if it's on a northern First Nation? Can you talk about how...
Yeah, so it's in a First Nation. And so I won't speak specifically to the details there, and direct you to Funib, who can answer some questions on that.
And are they all but one household contacts?
That's what I believe. They're all close contacts. I'm not absolutely sure the same household, but close contacts.
Dr. Roussin, have there been any cases of COVID-19 that spread at a wedding, to your knowledge?
In Manitoba? In Manitoba, I haven't been aware of a wedding specifically. We've had, for the most part, fairly tight restrictions on that for most of our pandemic.
And how about, I know that earlier in the pandemic you did mention a funeral, but what about funerals recently? Do we have any cases?
We do have some cases that have been linked to funerals.
And do you mind, do we know, forgive me, I ask you this often, but I'm going to ask again, do we have better epidemiology on the cause of the Bethesda outbreak now? Do we know?
Not, we have an idea, we have an idea on some of the factors on there. Nothing that really changes, our approach, just tries to, shows the importance of staying, not losing any, you know, the importance of that this virus is always around.
Can you confirm the Heritage Lodge outbreak started with a sick patient coming in from the hospital, a new resident?
No, I can't confirm that.
Minister Friesen, can you tell us a bit more about the new testing site that's going to be set up this week? Will it be the mobile unit? Will it be at Dynacare's existing permanent location labs? What can you tell us?
We've engaged a Dynacare to be able to provide additional screening site capacity. I also want to mention at the same time that we are undertaking a very significant review, kind of a top to bottom review on our capacity at this point in time. It will be expedited. It is designed to see when it comes to screening, when it comes to lab testing, when it comes to the contact tracing, and then the public reporting back of those results, where we are doing well, where we could do better, and what we need to add. Part of the early analysis was that we needed to add screening sites, so we are pleased to see Dynacare coming in to do that. There's a broad array of locations that are continuing to be reviewed to see how useful they will be. This first site will be opening, I believe, Wednesday, and we'll be able to provide more details to you on Wednesday of where we're anticipating to have other sites. You will have seen also last week in a bulletin where we had indicated a number of communities, not just in Winnipeg, across Manitoba, where we're hoping that these new screening sites will add capacity.
Dr. Roussin, we're hearing of fairly lengthy wait times for positive COVID-19 tests. Can you tell us what are the average wait times for a positive or a negative test currently?
Yeah, and so the test turnaround time hasn't really changed much throughout, throughout recent times. From our data, we're looking at, roughly 97% of people are getting or positives are getting their results back within 48 hours. So certainly we want to continue to improve that. We hear of anecdotes of delays on getting positive, so we're going to constantly look and see why that might be.
Go ahead.
The Premier of Ontario said they were in a second wave. Would you call this a second wave here in Manitoba, what we're seeing?
Yeah, I mean, I think when you plot out what we call an epi curve on this, you can see two distinct waves, and they're behaving a little bit different as well. We saw a much younger cohort in this wave being affected. We see much lower admission rates to hospital in this wave. So yeah, I think it's accurate to to consider that term with it. So it's certainly we're in a distinct period than what we saw in the beginning.
Minister Friesen, is the province lessening or loosening any of the restrictions for personal care home workers to work at more than one site right now? Because we're hearing people are being asked if they want to pick up extra shifts at Bethesda in other homes.
No, there's been no change to the orders that are in place that restrict workers at personal care homes to one personal care home site. Those orders were renewed and extended recently.
Dr. Roussin, the 20th patient who died, is that person in a hospital or a personal care home?
Hospital.
ICU?
No.
Not long-term hospital care or
No, acute. Yeah.
acute? And Minister, we've heard the City of Winnipeg yet again today said that they still don't understand precisely how this health order pertains to their facilities. When will that be communicated to them? Can you communicate the questions they have regarding recreation and other facilities now?
Well, I mean, I believe the orders are clear, and that Dr. Roussin has been clear on what these orders will mean for masks indoors, what they will mean for gathering size restrictions. But if the city has specific questions beyond that, we have personnel, and public health has personnel that are engaging to answer those questions.
I understand. How is it possible that there can, the mayor again said it today. How is it possible that the two sides of government can't communicate more effectively in the midst of a pandemic?
I think that the two sides of government continually communicate with each other. So if the mayor has questions that the mayor feels that he wants additionally answered, the commitment is there to answer those questions.
Dr. Roussin, in the schools, the mandatory masks are for grade 4 and up. For the citywide rules right now, do you have recommendations for the age of people that should be wearing masks indoor public places?
Yeah, and so for the mandatory mask indoor public places, we're age 5 and up. with it. For childcare centers and schools, they're not the orders don't apply to them. They're dealing with that through policy, and that's the grade 4 and up. The distinction there is just really the adherence. Going out and about just for an hour or two, you're going to have a mask on, 5 and up. Grade 4 and up, sitting for 8 hours a day. We're wondering about the adherence to it, and it's consistent with national guidelines. So that's just the distinction there.
Yeah, I don't imagine public health inspectors are gonna be carding 5-year-olds.
No, from public health at the beginning, it's all about education. It's all about supporting people. It's not about trying to use coercive measures, at least not at first.
Thank you, Doctor. We're going to take a few reporters from the phone, starting from the Thompson Citizen with Ian.
Yes, hi, Dr. Roussin. I'm just wondering, do you know if any of the 13 people hospitalized, if any of them are in Thompson?
No, I don't have that information with me, the location of all admitted patients.
Okay, thank you. And I mean, are you, given that the number of cases in the north has sort of almost doubled in the past few days, I mean, are you concerned by the recent rise in places where there's maybe not the health system capacity to deal with as many patients?
Well, right from the beginning of the pandemic, we knew we had to do what we can to protect those remote isolated communities because of the reasons you just stated. We do know that there's been the increase in cases. We know, of course, we're concerned when we see that. Although we know this recent 7 are all related to close contact.
From the Brandon Sun, Michelle.
Yes, hi, Dr. Roussin. I think I misunderstood. I couldn't quite hear what the other reporter was saying there in the room, but I am wondering about the Brandon Regional Health Center's Assiniboine Center, which is still under Code Red. So double-pronged, you had stated that after 2 clear incubation periods, the province would look at lowering the red level. So what's the situation with that? And if the death is not related to that center, what is it related to location-wise? And I also have a second question.
So for personal care home or institutional outbreaks, it'll typically be 2 full incubation periods after the last associated case. So I don't think there's any recent updates at the Assiniboine Center, but we haven't seen 2 full incubations since the last case there. And then the individual who had the 20th death here was related to, was hospitalized, and then we report on the region, the Paramount Health region, but we don't report on the location any further.
Okay, great, thanks. And my second question was, I'm also wondering about Halloween. Parents are already asking what they can plan. Kids are talking about their costumes. And I'm considering the pressure we're putting on children already. And I'm wondering, shouldn't that information come out sooner rather than later so that parents can plan with their children what can happen and what can't? Do you have a date for your plan, or?
No, I agree. I think we're going to try to get a plan out, give some guidance. I mean, the fundamentals we're always going to apply, and we'll have some specific guidance on that. I mean, I do think it's important, but we've also been dealing with a significant number of cases that public health is trying to work on and deal with new public health orders. But absolutely, it's important, and we're working on that.
From CJOB, Merrick.
Hey, Dr. Roussin. I just have a question as pertains to youth sports, sports in general. I know if there's any further restrictions coming, I know lots of sports are still waiting to hear if they can even have games like basketball and hockey. Is that decision delayed now, and when do you think we can get further guidance on minor sports?
Yeah, well, that guidance has been out for quite some time, and these orders don't change it. And so a lot of those decisions are being made at the regulatory level. on whether they want to or whether they can return safely. So public health has provided guidance. It's online on sporting events, what they need to have in place to minimize risk, right? Of course, we're not going to have a sporting activity with zero risk. We're not going to have any activity with zero risk. But there are guidelines out there, and it's up to each organization to decide on whether they can implement those and return to play. And public health can certainly provide, advice on certain aspects of that.
Thanks, and just one from a listener now. If you're in an office that doesn't deal with the public, do they need to wear a mask, or would that be up to the employer?
That's right. So the current public health orders are public places. So any public-facing business would be required to wear masks in any areas that face the public. Otherwise, then it's not required. What we say, if you're seated in an office and distanced, then that would be an okay time to remove the mask.
From the Winnipeg Sun, Scott.
Good afternoon, Dr. Roussin and Health Minister. Question for Dr. Roussin, or maybe even both of you. With the cases in New York Factory First Nation, what is being done today, right now, to help minimize the spread of that within the First Nation? Just given that, I mean, it's not communal living there, but they are close-knit, communities. What is being done to kind of aid or assist this community today?
So all the First Nations, they've had these pandemic plans in place. They work with FNIB. They also with a number of organizations with it. So plans are in place. What's being done, is really done on, late last week when those rapid tests came back, is the case identification, isolation, contact investigation, and isolation, and a search for further contacts. So that's the main work of public health.
Okay, and just a follow-up, and forgive me if I didn't hear it correctly, but I think you said earlier that, let's say, 10 people over, that means you could have, technically a household of 10, that could have, or who knows, however many. Is that advised, though, given that, these can turn into super spread events potentially? Is that advisable?
The public health advice is to limit your contact with others outside of your household. That's the advice. When these are the first orders that we really directed against private gatherings. If you check the other orders in Paramount Health, they were public gatherings. And so we wanted to find that balance for, as we did this. We know that there's some households with larger numbers of people living there. And so that's why we moved to exclude the household from that count. And over time, we may have to reassess that.
From CBC Radio Canada, Gavin.
Hi, Dr. Roussin. We're hearing from some parents who, figured out that a child in their child's cohort has tested positive for the coronavirus, or saying they haven't been notified that their child's a close contact. So I was just wondering if you could explain to us how public health determines which person in a school cohort are close contacts to a person who has the virus.
Yeah, so close contacts are those people who spend greater than 15 minutes within 2 meters of a infectious person. And so when there's a case in the school, the public health will work with that school and look at the seating arrangements, look at any activities, and work closely to try to identify who is close contacts. Sometimes they're able to do that and find who is a close contact. They will inform those people that they're required to self-isolate. If they're unable or not confident that they could identify only close contacts, then they might have to notify the entire cohort to self-isolate. But it really depends on the situation, and those who are determined to meet that criteria for being a close contact will be notified by public health.
On another subject, can you tell us how many active cases in Winnipeg are related to bars and restaurants?
Well, we don't have, it's a tough number to have. I know when we did the epidemiology late last week, we saw, I think it was 47% of the cases within that past 2 weeks were at a restaurant or bar within the acquisition period. Doesn't mean they acquired it there, doesn't mean they're necessarily linked to it, but that was the number that we came up with.
From CTV, John.
Hello, Dr. Roussin. Just to follow up about the schools and some people being sent home and others not, how do you guys, though, determine who, in fact, has had more than 15 minutes of contact? Because the kids are all mixing around and they're moving back and forth and so forth. Some, may turn. They're not always, for example, looking directly at the teachers. So how do you determine that some have had more than 15 minutes of contact and others have not? And shouldn't, for safety purposes, maybe just they all be informed?
Well, it depends on the circumstance, and so you're right. Sometimes we may not be able to determine that, and then we have to say to the whole cohort. But it depends on a number of circumstances. It depends on how far people are seated from each other. It depends on things like you said. Were they moving around that classroom a lot? Was there other things going on that won't make us confident in it? So public health does this not only for schools. This is the contact investigation we do for so many conditions, including COVID. And public health does that, as their professional practice, trying to determine who is a close contact. So we know that we've seen a number of cases in school, but outside of John Pritchard, we haven't seen much transmission within school. We have those cohorts in John Pritchard, but otherwise, for the most part, that contact tracing has been fairly effective.
And my other question is just about the mandatory masks. I'm wondering about enforcement. Can you tell us who's going to be doing it? Are businesses, restaurants, are they responsible for the enforcement to ensure that everyone does wear it, whether maybe they may or may not want to? And if they're not responsible for ensuring that everyone does wear the mask, will health inspectors do it? And if so, do you have enough health inspectors to cover the entire province?
So under the orders, private establishments are not required to enforce mask use. They are required to remind people to wear masks. A number of places, even before the mandate, had their own enforcement in place, not allowing patrons to come in who weren't wearing masks. So again, it's like most of the public health orders, and masks certainly is, will have to work in that manner, is that most people follow the law. Most people follow public health advice. So we're going to expect most Manitobans to follow the mandate. And over time, we're going to just see that normalization of people wearing masks in indoor public places. It's in the public health order, so there is the opportunity to enforce. But we had this in force in Prairie Mountain Health and saw a good uptake there, and we'll expect the same thing in the Winnipeg metropolitan area.
From City News, Jonas.
Good afternoon, folks. Jonas Gilbart, City News. Dr. Roussin, Minister Friesen, this is for both of you, I suppose. As we see the cases rising in younger folks, millennials, I guess we could say, when it comes to messaging for them, is there anything different that needs to be done? Have you learned anything about that through this pandemic?
Yeah, well, I think it's, what we're talking about now, obviously it's venues. So it's a focus on certain venues. So we know that we're seeing, some acquisition occurring in bars. And so that's why our messaging about that is occurring, and in working with those industries to try to make it even safer moving forward. But the messaging for the most part remains the same. And we know with a virus like this that even though you might have one age cohort affected right now, this virus isn't going to stay in that cohort because that cohort obviously mixes with all sorts of people. People in their 20s work at PCHs. People in their 20s have younger and older people at home. So the messaging has to be strong, and that's why we moved to that restricted level.
and I guess I'll follow up with Minister Friesen. Are you confident your messaging is getting through to younger folks, and do you think there's anything that needs to be done to evaluate this?
Well, without reiterating what Dr. Roussin said, we're constantly re-examining the messages that we're putting out there. People do need to be reminded, and we are seeking to remind them through a variety of ways about the need to pay attention to this, to do the things that really matter, and if we need to sharpen that messaging based on the epidemiology that we are seeing in respect of this new surge in Winnipeg, then we'll do it. If that younger cohort, if that younger crowd needs specific reminders about the fact that even though they might feel more resilient, that they can import this back into their households, they can put it into their work places, they can transmit this to older population, including the people that they love. If those messages need to be sharpened and honed and presented in a different way to that younger demographic, we're going to do that.
Thank you, Minister. We now return to room 68.
Minister, do you have a TikTok presentation you're going to make then?
I do not, but we do need to think about how we reach that younger crowd. We need to make sure that our message is getting through, and so we're going to use a variety of means to do that.
Speaking of younger people, Dr. Roussin, I mean, last week you did talk about, some bar hoppers, but are the cases among young people simply a matter that they work in service industry and they're exposed more than older people are? I mean, looking at the epidemiology, how much of this is actually the exposures to young people versus the behavior of young people?
Well, it's both, right? And we see the 40%, 47% of those cases linked in some way to bars or restaurants, not necessarily acquired there. So that still leaves us with a significant proportion that's not linked to there. But you're right. So it could be. There are certain cases, and we want to highlight some of those high-risk cases of people, their behaviors leading to that. But you're right, some of this is dealing with that cohort that's working in industries that we're seeing transmission there as well.
We saw earlier on in this pandemic, people most likely to lose their jobs were younger people in the service industry. Is from looking at the epidemiology, is Winnipeg and Manitoba starting to look like other jurisdictions where at-risk people are more likely to be getting this?
Well, we're definitely seeing that younger group more so than in the first wave, and there's lots of reasons behind it, and it may be probably one of the explanations as to why our admission rate is lower in this wave, because we're just seeing younger people obtaining it. But moving forward as we work with those sectors, we're going to look at ways of limiting transmission both in people working there and in patrons.
Do you have the greatest hits
Data
question? Go ahead.
do you have data that separates out, and deep dive data that separates people obtaining it in a workplace at the bar versus socializing at the bar?
We do have the ability to do that. We certainly we have collect occupational histories on individuals with it, and so remember that a lot of these cases that we're reporting, this large proportion, we're not necessarily saying they did acquire it there. It's just that it's associated with that.
Somebody asks you this once a week, but the app, how far away are we from that? We have some news?
Yeah, I can give you an update on that as well. The Canada's COVID-19 app, the Alert app, is of course available to download. I believe that it's in Manitoba, determined to come online this week. So we'll have more to say in just a few days, but that work has gone on behind the scenes, as we said it was going on, to make it available and compliant in Manitoba. It had to interface with our health systems. People should understand, of course, that with this app, that I believe there's now 3 provinces who have that app working. It doesn't rely on GPS. It doesn't give government information about who you are or where you are. Rather, you download this app and it uses a Bluetooth technology then to link with others and their phones when you come in contact over that threshold period of time. And then I would also just remind Manitobans that with this app, then if you contract COVID-19 and you're determined to have done so, then it's still voluntary for you to then enter that one-time code into your app that will then send the signal to other phones and identify whether that contact has taken place. So I would say to Manitobans, now is the time to download that COVID alert application. You can do that today, and later this week we'll be turning that on and allowing it to have effect. Of course, this doesn't replace anything that we do conventionally in contact tracing. That work will continue to be the center of the efforts going forward to be able to make sure that we're getting the knowledge of who has COVID-19 and who is at risk.
Are you going to promote the use of it? Because this app requires a significant proportion of the population to use it to be effective.
Yeah, we'll promote that because, as you say, if 20% of Manitobans download this, it's not going to have any effect. I've heard numbers of 60%. Some have said higher adoption rates in order for this to be effective. I think the jury is out yet whether any jurisdiction will reach that level. But let's do what we can. It's another tool that we can refer to in this very complex response to COVID-19.
Dr. Roussin, we have seen larger outbreaks in care homes. For earlier, we had a case here, 2 cases there. We've got 3 large ones now. To what do you attribute this, and what is being done to prevent worse spread on top of the restrictions that you've already spoken about?
Yeah, well, what it's attributed to is just wider spread community transmission. So in the earlier wave, we had much less community-based transmission, and so as we see more in the community, then you're going to see more in PCHs, you're going to see more in other workplaces. So it's just a link to that. So what, I think if we look back at a number of these, that the measures we have in place can be highly effective, but they're quite challenging, and we just double our efforts to do what we can to keep this virus out of these situations.
In these new rules in Winnipeg, if I go to a restaurant or bar, I'm masked, I get to sit down at the table, I'm allowed to take off my mask, I get up to go get a beverage or the washroom or something, I have to put my mask on. If I do not, and there happens to be enforcement in the area, who gets the fine? Is it the business owner or is it the customer?
The individual. The business owners under the current orders are only required to remind patrons that they should be wearing a mask.
Dr. Roussin, what do you expect to see in 2 weeks now that we've had this upward trajectory? Do you have any kind of modeling, or are you expecting hospitalizations? Like, would they keep pace with the rising number of cases? What do you expect?
Yeah, so our modeling is based on different public health interventions, different scenarios, and so it's based on what restrictions we have in place and what uptake the public has of those interventions. So at each level, at each increased restriction, we look to see the numbers trending downward. So as we increase these restrictions, our modeling would tell us if there's uptake from the people of Manitoba, people of Winnipeg metropolitan area, that we'll see the numbers declining.
Is there any modeling for what would happen if you hadn't imposed the code orange restrictions?
There was just some preliminary modeling of the recent climb in Winnipeg, and it wasn't we didn't have any. It wasn't the agent-based modeling. We just sort of extrapolated over our other modeling, which showed significant numbers of cases and trailing that significant numbers of admissions.
What's community transmission rate right now for Manitoba and Winnipeg?
So overall, our 7-day non-epilink cases in Manitoba is 36 individuals and 31 in the WRHA.
36 individuals.
That's right. Yeah,
it's
36%.
Overall it's about a little over 19% overall.
And the number of cases and admissions that you would have expected to see had you not imposed the restrictions, what would they be for Winnipeg? Do you have any?
No, we don't have specific numbers, right? We just look at trends, and with our numbers it gives such a wide range of that. So we didn't have specific numbers on this many people would be in ICU, but we did see increasing trend in numbers, and in certain scenarios there, it put a strain on our healthcare system.
Dr. Roussin, I know you've touched on this before, but we're hearing frustration from leaders and communities outside of Winnipeg that are included in these restrictions. Can you again just explain why communities beyond the perimeter are included in these restrictions?
There's just so much movement in between Winnipeg and those communities, and then we didn't want the unintended consequence of group sizes just being high in a community that's just barely outside of Winnipeg. So and I think all through this, it's challenging these orders. We heard about the group sizes, the impact that has on certain sectors, certain individuals, and now these orders will have difficult impacts on certain geographic regions as well. So we know it's a challenge, but we're really trying to protect the health of all Manitobans by this. So we make these informed sort of choices, but we know they have big impacts.
How come there's a change in the screening tool? You don't need a sore throat for 24 hours now, just the onset. Why was that change made?
For the screening tool, so I think we were just seeing the just different one-off situations that we would see some patterns going where people were out while symptomatic, and we just wanted to try to provide a bit more guidance.
Is that why we have, last question, and in that case, we're seeing health links waits of longer than an hour again. We haven't seen that kind of thing since April or May. What sort of additional resources, what are you doing to alleviate the health links lineups?
Well, I don't have specific information on that. I think we always will, review those type of things. But as we see increasing cases, we're going to have increasing questions, with it, and
Keep an eye on it for sure.
Thank you very much.